Okay, so yeah, as I was saying, so my name is Asad Mian. I'm an emergency physician and researcher. I work at the Aga Khan University, and so the other role that I have over here is that of an innovator and entrepreneur. And the work that I will talk about today through this presentation is based out of critical creative innovative thinking, or CCIT, and you can see that at the bottom left corner of the screen, and that's our logo there. We are a co-innovation and incubation hub at the Aga Khan University. We delve into healthcare related innovation and entrepreneurship. More recently, we've also started looking at non-healthcare related innovation and entrepreneurship. So over time, we've kind of become sector agnostic. But for the purpose of this talk, I will delve more into the healthcare or medical side of things. The title of the talk is Entrepreneurship in Medicine for Low Resource Settings, the AKU Experience. This particular talk and presentation should be about 15 minutes. So Shanawaz, if you could just curtail me in case I'm kind of taking too long. And so I really want people to ask questions. And
of course, no problem.
Right. So then I don't want to keep talking over here in case I'm kind of, just rambling. So please keep me on time. And should I just get going?
Yes, sir. Yes, sir. Please go ahead.
Okay.
Please,
Okay.
yes.
Okay. So I have nothing to disclose. Over the next 15 minutes or so, hopefully what the outcomes of your learning objectives of this particular session, the last one I'm showing you first. So I really want to delve into AKU's entrepreneurial journey. And when I say AKU, please keep in mind that I'm presenting the work predominantly of the Innovation Incubation Hub, CCIT, which is housed at AKU. There are other entities at AKU that are also doing entrepreneurship, but I will focus primarily on our work that we have done at AKU and what we've learned from it. Prior to that, I'm going to make the case for the need for medical entrepreneurship in low resource settings. I don't want to assume that everybody knows who an entrepreneur is and what is a startup. So I'll kind of give you a working definition that I think works really well, at least for me, and I'm going to link it to medicine or healthcare. And what we will start off with is really this: describing healthcare's burden in Pakistan and why do we need to do all of these things. So Pakistan has an immense burden of disease, and this is not this should not be news to you. I'm just going to list a few points here. We rank very high in neonatal and child mortality. What that means is that babies under 30 days of life, and children under 1 year, and children under 5 years. So all three categories of neonates and children, they're dying in huge numbers. And there's a lot of illness in that same age group, in those age groups. Maternal mortality is really high, which means that women during their pregnancies and during labor and delivery or childbirth, there are a lot of women dying because of pregnancy and childbirth related issues. So maternal mortality is really high in Pakistan. There's a huge surgical inequity or disparity between urban and rural areas of Pakistan. So access to surgical care is very patchy, and a huge disparity right there. And then we have a huge trauma or injury load. So lots of road traffic accidents. We don't have very good trauma control or trauma prevention systems. Hence, we are seeing more and more trauma and injury related issues in Pakistan. So through the WHO categorization, we suffer from what is called the triple burden of disease and illness. And what that alludes to is the communicable or infectious diseases, whole group of that, including infections such as COVID, for example. So that's communicable. Then there's the non-communicable diseases, and those would include heart attack, psychiatric or mental health related issues, and diabetes, and so on and so forth. And the third category is trauma and injury. So the triple burden, immense in all those three categories for Pakistan. This is a graph that I really think is exceedingly insightful, and I've shown this in my talks before as well through the innovation lens, but I'm going to extend this to the innovation, creativity, and entrepreneurship platform, right? So, so the title of this is why even bother to be innovative, creative, and entrepreneurial in healthcare. Just look at this. What this is showing you on the y-axis is total health expenditure per capita, and that's in US dollars. And you're seeing two nations being compared: USA in orange bars over here against Pakistan, which is in blue, and over a time period from 1995 to 2014. So it's a dated slide, but you can just imagine that for the US, the bars are probably going higher and higher, and COVID hasn't been kind for the globe. So the total health expenditure per capita is probably going up and up and up for the US, and Pakistan is kind of flattened, and it's kind of like a plateau. I don't know what the more recent numbers are. I won't be really surprised or shocked if they haven't really gone up. So based on just this, what I take home from this is that there's a need for all nations, whether they're high income, low middle income, doesn't matter. All nations globally probably require to be much more innovative, creative, and entrepreneurial in healthcare, just because if the healthcare expenditure is very, very high, that's not a good thing. If the health expenditure per capita is very, very low, as in the case of Pakistan, that's not a good thing. So you can use the tools of innovation, creativity, and entrepreneurship to actually improve these numbers, go up when the expenditure is really low, and go down when the expenditure is way too high. Okay, I won't go into more details. Who is an entrepreneur? I can't see the audience because this is a full screen presentation. So I wanted it to be interactive, but Shanawaz, do you think we can kind of ask people to
Of course.
put
So
something in the chat box?
Their inputs, so we can ask them.
Yeah, so why don't people put in the chat box, and then don't be shy. There's no wrong answer over here. Yeah, who do you think is an entrepreneur? And then second question would be who is a medical entrepreneur, or who is a healthcare entrepreneur? So you can just put some thoughts over there in the chat box, and then Shanawaz, you can kind of let me know what people are saying. And don't overthink.
So I just wrote in the chat, business entrepreneur is a business person.
Okay, a as a businessman, a businesswoman, or a business person. Okay, fine. Others, anybody else wants to offer a few thoughts? Who is an entrepreneur? No one? Okay, Nida is saying an entrepreneur is a person who takes a business risk for gaining monetary benefit. Nice. So you're putting in risk over here, and this definition of yours is around monetary benefit. So Madhya is saying bringing new ideas to a business, and I love this. Really good description of an entrepreneur, bringing new ideas to a business. So innovation is novelty, new ideas. Okay, so someone who first identifies and then capitalizes on a market gap. Excellent. So different ideas coming through, right? So not just restricting yourself to being a business person or a businessman or a businesswoman or a business person. You're bringing new ideas, you're identifying market gaps, and then you're capitalizing on that, and you're taking a risk, and you're potentially gaining monetary benefit. So these are all very good characteristics of an entrepreneur. And so I'm going to just simply give you the definition from this particular paper. So an entrepreneur is someone who organizes, manages, and assumes risks of a business. And if the question is who is a medical entrepreneur or a healthcare entrepreneur, then it would be a person who organizes, manages, and assumes risks of a medical or a healthcare business, right? So not that complicated from that perspective. And several characteristics you've already identified and told me. So thank you for playing. Okay. What are the 21st century skills, and why am I asking you this question? I know my team has been drilled time and again. grilled and drilled about this. So again, just put some thoughts over there and I can
algorithms. Madhya wrote.
oh, okay, there we go. Okay, Madhya wrote algorithms is 21st century skills, algorithms via AI. Okay, leadership, entrepreneurial mindset. Yes, and I think you can see my slide, right? I think you could see it now. So, oh, sorry, there we go. Right. So entrepreneurship or being entrepreneurial or an entrepreneurial mindset is very much part of the 21st century skills, as is things like adaptability, social, being socially driven, awareness of that kind, communication, analysis, solution, mindset, collaboration, empathy, and so on and so forth. Innovation and creativity are also considered part of the 21st century skill set, and leadership. A lot of leadership qualities are part of the 21st century skills or skill set. So entrepreneurship becomes equally important when you think about the 21st century. So what do you think is the ethos or essence of a tech-based startup? Tech is in brackets over here, but startup generally, but let's say you want to keep it relevant to a tech startup, and then think about a medical tech or healthcare technology related startup. What would be the cornerstone of that? Or what could be the cornerstone of a driven team and a great idea? Very good.
So yeah, I think
yes,
it should be a driven team and great idea.
Very good. So yeah, so Asad is saying scalability. Nice. Yes. Any other things that you can think of? A gap in healthcare provision. Very good. Excellent. Because another way of looking at this gap in healthcare provision is, what is the problem that you have identified that you're willing to solve because you're passionate about that problem? Sidra is saying, imagine and creating new technology. Excellent. Fabulous. So, sorry, let's see who else. Integrity, much better improvement in the previous problem. Very good, Fahad. So, all excellent answers. So okay, so if you think about this, simplistically, kind of just breaking it down. So what is the challenge? The challenge is to imagine and create new technology, because this is a tech-based startup. So you've got to have an aspect of technology. Now that could be, it doesn't have to be high tech, it could be low tech, but technology for sure. And the thing I would add to this is, which is not part of this figure, and it's not part of that chapter, or at least that particular text from this book that I have used as a reference. I'll talk about that towards the end of this presentation, is what I mentioned about the problem. So always consider the problem to be a very important aspect of this. Be very passionate about the problem that you want to solve, because your startup or your solution is going to be hinging upon the problem. It is exceedingly important to be very clear about the problem that you're trying to solve. What I come across with a lot of startups, and healthcare startups also suffer from this, is that individuals or teams are unable to really articulate the problem that they're trying to address through their startup. They're so wedded to the technology or to the solution, even if it's a non-tech solution, that they are unable to give much thought to the problem that they're trying to address. So please do give a lot of thought to the problem that you're trying to solve. Okay, so new technology tends to come from new ventures, and those are startups then. And I love this because somebody even in the chat box mentioned about teams and ideas and people working together. So small groups of people bound together by a sense of mission. So startups are very mission oriented, and startups, and I don't have to kind of belabor the point over here, with this mission of groups of people who are bound together by a sense of mission, have changed the world for the better. And there's not enough time, but we can get into ideas or examples of what do you think. I mean, every person could come up with their favorite startup and how that particular startup has changed the world for the better. Why do you believe that to be the case? And so at some point we can get into a discussion or a conversation around that. It'll be lovely. Okay, just moving on. I'm going to switch gears now and talk about entrepreneurship at AKU, the CCIT way. And the content for these slides is from the book MEDJACK, and you could see, okay, this is the MEDJACK logo down here, and the reference is from chapter 4 of MEDJACK, which is on incubation. So please do get hold of the book, and I'll tell you more about the book in a bit. So the figures are from that particular chapter. So our entrepreneurship journey really starts from hackathons. Hackathons are multidisciplinary events in which people from different backgrounds come together and solve problems in real time. And these hackathons tend to be weekend hacks in which people from different disciplines come together. And we've done them at AKU as well as virtually or hybrid models over the past 6 or 7 years. And I'll tell you more about the hackathons in a bit. So what you're seeing over here is this funnel, and you're seeing different disciplines, different topics of the hackathons, and just 3 examples out of several. There was a hackathon on pediatrics or building a children's hospital. There was one on emergency medicine. There was another one on medical education hacking. And so this is like a funnel. So you have a lot of themes, theme-based hackathons coming through, and then the ideas that come out of hackathons get filtered through. And then what you're seeing below is called the I2S incubation program. The I2S stands for the innovation and incubation space. You can see the logo over here. And this was our version of a quasi-virtual incubator at AKU. Which we started several years back, and the reason for bringing this to life was that after the hackathons, we felt that most of those teams or individuals in those teams would actually go back to their busy lives, and then they would stop working on their startups because remember, the hackathon is really a weekend of hacking. So we put together a comprehensive incubation program which would help the startups be incubated, at least the early stage of the business incubation side of things. And this was the methodology that we utilized, and we went through several cohorts or several iterations of our incubation programming. And over here, what this is showing you is the I2S network. And it's the title over here is Global and Local Partnerships with SMEs representing diverse fields. SME stands for subject matter experts. What the I2S network was essentially doing was actually connecting startups or early stage startups with subject matter experts. And those SMEs or subject matter experts would be from technology, could be investors, could be from the field of digital learning, could be policymakers, could be academics, could be obviously healthcare like doctors, nurses, and so on, and entrepreneurs, right? So this was a network that would help build the startup further. And this is just one example of the various incubation cohorts, and this was from the global surgery incubation cohort. And this might look a bit complicated. I'll break it down for you. What you're seeing on the y-axis are a number of different startups. Okay, the bars, horizontal bars, are meant to be different individual startups from the global surgery incubation cohort that came out of the global surgery hackathon. And what you're seeing on the x-axis is the number of milestones through tasks that these startups were going through over a timeline. And so the 0, 2, 4, 6, 8, 10 is supposed to be the weeks of the milestone-based curriculum that we took these startups through. And the color coding over here, as you can see over here on the right, can you see the cursor when I move it? I'm sorry, I'm assuming that you can.
Yes, we can see it.
Okay, good. Okay, so you can see the key over here is showing you different aspects of the incubation cohort milestone-based curriculum. So, for example, this blue over here or purple over here is napkin sketch, then customer profile, problem validation, customer profile 2.0, competitor assessment, product scope, costing and opportunities, prototyping, strategy and development, complete business plan documentation, prototype completion. So this was a whole spectrum, right, from beginning to end, but you can see that different startups were maintaining this at a different pace as well. Not everybody would go from alpha to omega or beginning to end, and that's expected in an incubation cohort. So this is just one example of several, and you can read more about it in chapter 4 of MEDJACK. Okay, so summarizing our early stage startup, healthcare related startup experience at AKU is through this particular slide. And this is over a period of 6 or 7 years from 2014 to 2021. Like I mentioned, this was a very interesting paradigm in which we started off with hackathons, several hackathons, and then we would then filter startups or potential startups from the hackathons, the ones that we felt were dedicated to go through incubation programming. And hence you can see that the numbers were higher for the hackathons in terms of participants and teams, and then that would get filtered down to fewer teams that we would then take through the incubation programming. And that has been essentially our experience, and more details in the chapter. So please get hold of that. Okay, I'm going to talk about challenges, and then you'll start realizing that those exact challenges are also opportunities for learning and opportunities for growth. So healthcare, for those of you who are not directly related to healthcare, if you're not from a medical or nursing background, for example, or you don't work in a healthcare organization, then it's important for you to realize that healthcare is heavily regulated. Startups or entrepreneurship in healthcare, hence, overall is much more complicated. It's much more difficult as compared to, let's say, I don't know, e-commerce, for example, or fintech, which doesn't have to do with anything related to a medical setting or healthcare or hospital, for example, right? Because this is the crux of it. Healthcare is heavily regulated, rightly so. This is a challenge, a huge challenge for healthcare entrepreneurs, but great opportunity for learning and for navigating this and coming up with a great startup. Policies should favor the innovator and entrepreneur, and we know that very well, because what's the point if the startup is not owned, intellectual property is not owned by the founder and the co-founders, let's say. So flexible IP is intellectual property, and COI is conflict of interest policy. So you have to realize that when you make those policies favorable for the innovator and entrepreneur, in a healthcare organization or an academic healthcare organization, a university, for example, opens itself up to risk as well when you have flexible IP and COI policies. So it's a double-edged sword. In a utopian environment, you should give 100% IP to the innovator entrepreneur or to the startup, but as an organization, you're also opening yourself up to potential risk. So keep that in mind. So it's a double-edged sword from that perspective. And this quote from the chapter is a very good summary of that. So navigating choppy waters, startups that came to us would say, and these are groups of medical students and nursing students working in this for their startups. So give me conflict of interest and intellectual property, or give me death. So it's an interesting take on IP and COI in an academic healthcare institution. So the next 3 points I just want to raise as potential questions, because there's no time to kind of address each and every insightful or reflective question, but it's just for you to think through. Being entrepreneurial versus being an entrepreneur. Do you think it's the same thing? Do you think it's different? Do you think it's it's a different mindset entirely? Is it more important to be entrepreneurial within an organization? And it's okay not to be an entrepreneur then? If that's the case, then what's the difference between being intrapreneurial versus entrepreneurial? And then just link it to healthcare or medicine, because that's what this talk is about. But it could be equally relevant to non-healthcare settings as well. Third question, keeping it jugaad-like. Jugaad is just improvising and cutting, like fast tracking perhaps, or how can you do things quicker, faster, cheaper, without necessarily getting stuck in bureaucracy and so on and so forth. So jugaad from that perspective. What about low cost and low tech innovation and entrepreneurship? What are your thoughts on that? Are those challenges or are those opportunities? So just kind of, let those kinds of thoughts or questions percolate. So I'm coming towards an end. So what has been the CCIT spectrum or modus operandi? So if you map out our entrepreneurship journey, then it's really been, so it's not been entirely just startup centric, because otherwise I would have just focused it on incubation right here and would not have kind of shown you pre-ideation and ideation and said, okay, fine, let's just talk about startups and let's just start off with this particular section, which is incubation and early stage versus late stage, right? But what we have learned over the past several years is that this very important perspective to pre-ideation and ideation, because if you don't give enough time to design thinking strategies or human-centered design thinking, which might fall more within the pre-ideation and ideation stage of things, then I think you're kind of like doing disservice to entrepreneurship as well. We've learned about this through the innovation spectrum, but entrepreneurship is linked to innovation. Creativity is linked to innovation and entrepreneurship as well. So that's based on a spectrum where CCIT is concerned, and hence I'm showing you this particular strategy or spectrum, and mapping out different aspects of it. CCIT is not really an accelerator, but we are very much connected with accelerators such as Accelerate Prosperity or AP. And a lot of you are very familiar with AP and how AKU has partnered with AP. So, this is that innovation ecosystem building as well. So over here, what you can see is mapping different tools or different implementations of CCIT. Hashtag C2I is what we consider to be an evolution of CCIT going towards humanities and social sciences, incorporating arts and humanities and social sciences into our processes as well. When I mentioned at the beginning that we consider ourselves to be sector agnostic and interdisciplinary or cross-disciplinary within an academic institution such as AKU. So this is that pivot that CCIT is going through, and it's a lot of fun. It's really exciting. So different implementations in these yellow bars over here, yellow boxes, and entrepreneurship is really one aspect of this larger universe over here. So that's the point I wanted to emphasize over here. Okay, last slide. So my conclusion is really about redefining entrepreneurship, and the quotation is from the book, Peter Thiel's book, 0 to 1. It's a fabulous read for all of you budding entrepreneurs or established entrepreneurs if you haven't read from 0 to 1. And he says in the book, the most valuable businesses of coming decades will be built by entrepreneurs who seek to empower people rather than try to make them obsolete. And I really love this because I think there's potential to kind of redefine entrepreneurship right over here. So two things I'm going to emphasize over here or get you to focus on. Entrepreneurs who are entrepreneurs, and all of you kind of define entrepreneurs and gave the characteristics. I think entrepreneurs are really empathetic problem solvers. They've identified fascinating problems that they want to address through solutions that are tech-based or non-tech-based for that matter. But they're really delving into empathetic problem solving. They're empathizing with their potential clients or customers. And the other point over here is people. When you talk about people, I think it's so important now in the 21st century to not just think of people outside of the context of environment or humanity within the context of its environment. Because if we don't focus or work on the environment that is fast getting depleted of our resources, and we are damaging it, human beings, we are damaging it left, right, and center. I think it's exceedingly important for entrepreneurs and entrepreneurship to redefine itself as being empathetic problem solvers who are going to empower humanity within its environment. And that's how I see us really doing great things and improving human beings a lot. And that's about it. Thank you very much. And references over here, Peter Thiel's book, From 0 to 1. fabulous read. And here's the cover of that. And the other fabulous read, if I may, is MEDJACK, The Extraordinary Journey of an Ordinary Hack. MEDJACK.net is the website. You can go look up and you can order the book. It's available as a digital book through Amazon, or you can order the print copy in Pakistan and it'll be delivered to you. MEDJACK.net. And chapter 4 is on entrepreneurship. So that's it. I will stop sharing my screen.
Thank you, Dr. Asad. It was a very wonderful presentation. And everyone, if you know more about CCIT and what's AKU is doing, you should take a look at this book, MEDJACK. It's you can go to website www.medjack.net, and you can read more about this book. So let me explain to you guys about Biospiel, our platform. It's a web-based application for doctors, radiologists, medical professionals, students of medical science, scientists, and researchers of medical science. It's free to use. We have just built our first version of our web-based portal. You can come to this site, biospiel.com, and when this is the landing page. You can just create a new account. So I'm just giving you a demo how this Biospiel works. So you can just select your profession. Let's say you are a student of medical science. You can write your first name, your last name, your email address, your password, confirm password, your institution name. Let's say you're from AKU. Your country, you are from Pakistan. Type your specialty here. Let's say radiology. Subspecialty here, abdominal imaging, addiction medicine. You can upload your workplace ID, school ID, institute ID, license, profession, registration certificate, or clinical degree certificate. That's just for your verification. After you upload it, and then click on register. I already have an account, so I will just log in. So I just logged into biospiel.com. This is a web-based application for medical professionals. This is the home feed. As you can see, some medical images being posted by some users. So you can see here some medical images being posted already by the users. And if you click on the image, it opens in the full screen. So you can if you want to go to your profile, you can go to your profile. You can create your own profile, just like any social network. So it's a web-based application for medical professionals in which they can share and collaborate on medical cases. They can make medical decisions. They can create medical articles and so on. So if you click on this plus button, you can share a case, share a decision, and post an article. Let's say I have a case to share with medical professionals. It's a medical case. You can upload here any pictures or videos of your medical case. So I can just upload some pictures. So these are medical pictures. Let's say you can talk about the case title. Let's say it's a stroke case. You can talk about the case summary. Patient is suffering from stroke. Patient is 30 years old male. And you can talk about the case summary. And you can talk about the specialty. Let's say it's acute care, subspecialty, abdominal imaging. I agree to the community guidelines and content policy, and click on share a case. After you share a case, our global team will review this case for patient private information. And as you can see, your case has been sent to our moderation team for review. To ensure patient privacy, every case is reviewed before being shared on Biospiel. You will be notified once your case is available to the community. So this case is being reviewed by our team, and then after it's being reviewed, it will be shared with the community. So if I go to my profile, this is my profile page, and this is the cases, decisions, and articles. So this is the case I just posted, and it says pending. This is pending. After we review it for patient private information, then it will be published. We are GDPR and HIPAA compliant. due to GDPR and HIPAA compliance, we have to review every case and decision before it's shared with the Biospiel community. So as you can see, this is 5 points. Just like case, doctor can earn virtual currency coins in the platform after, if they want to share a decision. For example, doctor made a decision about brain tumor while studying a case. He can share the medical decision in our community and he can earn virtual currency coins. So we are gamifying the medical collaboration. So the gamification and medical collaboration is a very new field and it's growing. So just check out this website, guys. As you can see, this there are followers and following of the user. You can, just like case, you can share decision and articles. So this is Biospiel. So thank you everyone for coming to this webinar. Thank you, Dr. Asad, for taking your time, for valuable time, and talking with us. And this webinar is recorded and we will upload it on YouTube. And I hope that we will collaborate more in future with CCIT and AKU in any way possible. So if you guys have any questions regarding AKU role and CCIT role for entrepreneurship promotion in Pakistan, and any other question about Biospiel or anything, please write your question in the chat so we can answer your questions. Anyone have any question, please? It's the book name is yeah, I just found in the chat. The book name is MEDJACK. Please order this book, medjack.net, and aq.edu//CCIT is the URL of the CCIT. And if you have if you want to collaborate about anything about entrepreneurship in medicine, please talk to CCIT and Dr. Asad. Thank you everyone for coming, and this webinar is now being finished.